Hi, I'm Dr. Paul Raifenrath here for Upper Level Canine, and we're going to talk today about ticks and the diseases they transmit to our dogs. So we're going to start right off with one that is familiar to most people, and that's Lyme disease. So Lyme disease is caused by a bacteria called Borrelia burgdorferi, and that is transmitted through the deer tick in the eastern half of the United States, and also the western black-legged tick in the Pacific Coast region of the US. So these tick species are active throughout the year, no matter what the weather. Even with wintertime, they are out active and feeding if the weather is warm enough and the sun is out. So the larval stages of these ticks will feed on small rodents like mice, chipmunks, things like that. The nymph stages of these ticks will feed on the small rodents again, but also they will feed on larger mammals, especially dogs and people. So the adult stages of these deer ticks will feed on deer. That's their preferred host, but they will also crawl on dogs and people and feed on us just as well. So once the deer tick is attached and feeding, it takes about 36 to 48 hours for that tick to transmit the bacteria from the tick's gut to the host. So if we have a tick that is not engorged and you remove it right away, the risk of infection is relatively low. Most dogs tend to develop what we call subclinical infections. These are infections that do not show any clinical signs. So most dogs do have some natural immunity against these tick diseases. So dogs with acute Lyme disease will show up with fever, a shifting leg lameness, joint pain, typically in the wrist joints or the carpal joints, and the ankle joints or the tarsal joints. And we're also going to see lethargy, anorexia, depression. These dogs are typically really painful and they do not want to move at all. We kind of give them the walking on eggshells look. So these symptoms typically resolve in 1 to 2 days once we start antibiotic therapy. So we also see chronic infections in dogs, and these usually will show up as intermittent, persistent, shifting leg lameness, arthritis, and these may or may not be responsive to antibiotic therapy. So in rare cases, we will see dogs develop what we call a Lyme nephritis, which is a progressive inflammation of the kidneys that will eventually lead to kidney failure and death. Not very common, but we do see that Labrador retrievers and Bernese mountain dogs seem to be somewhat susceptible to this, so something we have to monitor for. So how do we diagnose Lyme disease? Typically, the classic clinical symptoms, the dogs are coming in with a fever, shifting leg lameness, and just kind of a dish rag on the floor. We also will do a blood test, and this is a rapid blood test that we do in-house. And we test for the Lyme bacteria, we test for Anaplasmosis, Ehrlichiosis, and heartworm. It's a very quick test that takes about 10 minutes to run. It's an antibody test, so we're detecting the antibodies to the Borrelia bacteria. But keep in mind that it can take 4 to 6 weeks for these antibodies to develop after the tick has started feeding on the dog. So occasionally we will see dogs coming in with classic clinical symptoms of Lyme disease, but they show up negative on their blood test. These are dogs that are in the early course of the infection before the body has a chance to produce antibodies that we can detect. So typically with these dogs, we will, if they look like a Lyme disease dog, we will treat them accordingly, and we use response to therapy as a diagnostic tool. And if these dogs are better in 1 to 2 days, we know we're dealing with a tick-borne infection. So reinfection of Borrelia and also co-infection with other tick-borne organisms is really common if we do not use monthly tick prevention. So how do we prevent Lyme disease in dogs? So using the oral or the topical flea and tick preventatives that are available, using those monthly throughout the year. Also, we do have vaccination. So vaccinations are very effective and very safe. The vaccine actually produces antibodies that are ingested by the tick, and it blocks the transmission of the bacteria from the tick to the dog. And so we basically are preventing infection. Vaccines do not cause positive tests for Lyme. Usually the vaccines are going to be a 2-shot series initially, and then we do annual boosters after that. These are very safe and effective vaccines for dogs. So we do recommend both vaccination and monthly tick preventatives for our dogs year-round. So how do we treat Lyme disease? So treatment typically is with an antibiotic called doxycycline. We usually treat twice a day for 4 weeks. Occasionally we'll have puppies get infected or dogs that don't tolerate doxycycline, and in those cases we will use amoxicillin for twice a day for 4 weeks as well. Doxycycline usually works faster and works better, and usually is well tolerated by most dogs if given with some food. There are some public health concerns with Lyme disease. So humans are at risk for picking it up with deer tick bites. Symptoms typically include a bullseye rash and usually joint pain, fever, just general lethargy and not feeling well. Occasionally in chronic infections, cardiovascular and neurologic complications can occur. So there is no vaccine that's currently available for humans. Treatment is the same as in dogs. Typically a course of doxycycline in most cases will manage the symptoms very, very nicely. So let's move on to the next infection or organisms that we see that cause tick-borne infections. And this is Anaplasmosis and Ehrlichiosis. So these two diseases are very similar, and they're caused by various species of anaplasma organisms and Ehrlichio organisms. And these organisms are carried by a wide variety of tick species in the United States. So symptoms typically include fever, joint pain, lameness, lethargy, anorexia, depression. We will see ocular or eye inflammation, and we can see very low platelet counts that can lead to spontaneous hemorrhage, which can definitely be a problem with these dogs. We do very commonly see subclinical infections in these dogs, and that's infections without showing any clinical signs. The important thing to note with Ehrlichia and Anaplasma, these organisms can be transmitted within 3 to 6 hours of the tick attaching and starting to feed, in contrast to the Lyme bacteria, where it takes about 36 to 48 hours for transmission to occur. So we do occasionally see persistent infections with Ehrlichia and with Anaplasma, and these can sometimes be resistant to antibiotic therapy, and that can be frustrating in treating some of our dogs. How do we diagnose this? Same test that we use for Lyme disease. It's the patient-side test that tests for Ehrlichia, several species of Ehrlichia, Anaplasma, Lyme, and heartworm. We also will do a blood smear on these dogs, and in many cases, especially with acute infections, we will see the organism residing in the blood, in the white blood cells. And that is definitely evidence of infection. How do we treat it? We treat it the same way we treat Lyme disease, with doxycycline twice a day for 4 weeks. It's important to note that dogs do not develop protective immunity against these organisms, so reinfection is really common, especially if we have non-existent flea and tick control. So there are no vaccines that are available for these organisms, and antibiotic therapy may not completely eliminate these organisms from the body. So that's where we can get into relapses and recurrent infections. So symptoms look usually identical to the initial infection when we see these relapses occurring. So prevention is basically with the oral flea and tick preventatives and avoiding tick-infested areas if that's possible. So public health concerns with Anaplasma and Ehrlichia, humans can acquire these through the tick bites as well, and the symptoms are usually identical to what we see in dogs. Usually fever, anorexia, depression, joint pain, generally feeling like flu-like symptoms. So some of the lesser known tick diseases that we have to be aware of, one is called Babesiosis. And Babesiosis is caused by a red blood cell parasite called Babesia. There's multiple species of Babesia that can affect dogs. These are usually transmitted from the bite of the brown dog tick and also occasionally from the deer tick. So dogs affected with babesiosis will typically develop what we call a hemolytic anemia. These dogs will develop, and this is an immune destruction of the red blood cells, which can be a life-threatening condition. We'll also see dogs developing lethargy, fever, depression, joint pain, generally not feeling well. So usually how we diagnose that is by looking at a blood smear. We can a lot of times see these organisms residing in the red blood cells, but we also have antibody tests and also what we call PCR testing for tick diseases. PCR is a test that detects the DNA of these organisms in the bloodstream, but this can only be used usually in the early courses of the disease. So treatment for babesiosis usually entails a couple different injectable and oral antiparasite drugs, and it kind of depends on the species of Babesia that we're dealing with. The final disease that we'll talk about is Rocky Mountain spotted fever. This is a disease that's caused by Rickettsia rickettsii, and that's transmitted by the American dog tick, the brown dog tick, and the Lone Star tick. This is much more common in the southern half of the United States, especially Missouri, Arkansas, Tennessee, Louisiana, kind of the central south. So this disease is characterized by what we call a vasculitis, which is inflammation of the small blood vessels. And symptoms usually include fever, joint pain, muscle pain. We can see a rash develop. We can see hemorrhage. And usually these dogs are very lethargic and not eating very well. So how we diagnose this is usually by the clinical signs that in the presenting dog. And also we will do some blood work, some serology, antibody tests. And also if we see these dogs develop these symptoms during certain times of the year and geographic areas that they have been in that where this tick resides, then we suspect this disease. Treatment is with doxycycline and usually twice a day for 2 to 3 weeks. If this disease isn't recognized and treated immediately, typically this can be a fatal disease in dogs. This does affect humans as well. So that kind of leads us next to what are the effective monthly flea and tick preventatives that we have available for our dogs. So we have the oral monthly tick preventatives, and these are called the isoxazoline class of drugs. So drugs like Simparica Trio, NexGard, NexGard Plus, Credellia, Quattro, and Bravecto. So NexGard and Simparica are FDA approved for the prevention of Lyme disease. So these medications are recommended to give monthly year-round, and they will also prevent heartworm infection and intestinal parasite protection. So these are prescription medications acquired through your veterinarian. And it's important to note that if you have a dog with a seizure disorder, you should probably use these with caution or avoid these altogether and use an alternative method for tick control. And that leads us to our topical monthly tick preventatives. The most common one, the one I like the most, is Vectra 3D. This one repels ticks and biting flies. It also kills and repels fleas and ticks very quick. It kills the ticks very quickly. Canine Advantix is very similar. That one is used monthly. It's a topical spot on, just like Vectra, and that will repel and kill ticks very quickly as well. Frontline has been around for a very long time, and Frontline Plus, we're seeing this product being much less effective for ticks. It's very effective for flea control, but for ticks, it just isn't that effective anymore. When it first came out, it was very effective, but we're seeing the ticks actually evolving to get by this topical medication. So it will kill the ticks eventually, but usually can take days for the ticks to die if they have Frontline on, if they get exposed to Frontline. So that's plenty of time for these ticks to attach and start feeding and transmit organisms to the animal. So we also have the Seresto collar, which is the only flea and tick collar that I recommend that works well. And this one does have an 8-month duration of effect, so you have to replace it every 8 months. So there are some general considerations that we need to be aware of with ticks and tick diseases. Most important, maintain your ticks on monthly flea and tick control and test annually for our tick-borne diseases. And that's a simple blood test that we run in-house, and we know within 10-15 minutes if the dog has been exposed to ticks in the last year. So also vaccinate your dog for Lyme disease. So the vaccine is considered a core vaccine for dogs that live in tick habitat areas. So we do recommend vaccinating for Lyme disease and using monthly tick prevention. The Lyme vaccine only protects against Lyme disease. So also we will see lapses in tick preventative administration. Once in a while we'll forget to give the medication to the dog, or if the dog spits it out or vomits it up, that dog is susceptible to getting exposed to tick and these tick diseases during that month where it missed its dose. So dogs that are not maintained on flea and tick preventatives, they can actually bring ticks into the house, and these ticks can crawl off the dog and they'll crawl into the next warm body that's available. And that puts us humans at risk as well. If you have wildlife in your yard or in the area surrounding your yard, from mice to deer, you have the potential for tick infestation in your property. So if you travel to different parts of the US, especially the eastern, midwestern, and southern parts of the US, you're at risk for many of these tick diseases. Keeping these dogs on tick preventative year-round is our best option. So also it's important to do regular full-body tick checks on yourself and your dog after being in tick habitat. So wear light-colored clothing. You can use some of the tick repellents like permethrin or DEET on your clothing if you desire, but please don't use those on your dog. Those are toxic to our dogs. If you find a tick that's embedded in your dog or yourself, take a tweezers, grasp the tick right at the skin surface and pull steadily and just pull the tick straight out. If there's any mouth parts that you see that are left in the skin, leave them alone. Digging for them further will probably cause a secondary infection. These will usually dissolve within a few days, so don't worry about those. Rarely cause a problem in humans or in dogs. So it's important to note that not every tick is infected with these organisms. It all depends on what animal they were feeding on before they fed on your dog or yourself. So our wildlife are reservoirs for all these tick-borne diseases. So keep in mind too that dogs do have natural immunity, some natural immunity against these tick diseases. Humans, we don't have the natural immunity that dogs do. So if we get a tick bite, there's a very good chance that we're going to develop a clinical infection. So why are we seeing an increased prevalence of tick diseases in the United States? There's several different reasons. Number one, the deer population is kind of at an all-time high, and they're the desired host for the adult deer ticks. People are also moving into tick habitat. They're moving into more rural areas and suburban areas where wildlife is very common. So we're also seeing changes in forestry practices, in fire suppression. Usually wildfires will wipe out any local tick population very, very quickly. So climate change is also a really big factor. So we're seeing warmer winters. These ticks are now active throughout the year. They seem not to care if there's snow on the ground. They tend to be much more active during spring, summer, and fall, but we do see activity, especially in the deer tick, we'll see activity during wintertime. Also, we are seeing some ticks migrating north, especially the Lone Star tick. The Lone Star tick used to be a southern tick. Now it has reached the southern quarter of Wisconsin. And this one carries a multitude of diseases, especially ehrlichiosis. And humans that get bit by the Lone Star tick, they have the potential of developing a red meat allergy called alpha-gal syndrome. And once you have that, you can't eat red meat ever again. So it's kind of a frustrating problem that we see with that tick. We also see migratory bird species moving these ticks around quite a bit. And also with people moving around with their dogs. That's another factor as far as dogs harboring these tick-borne diseases and traveling with their parents. They can pick up ticks that now pick up diseases from these other dogs. So these are some of the concerns that we have. I've been fortunate and unfortunate to see the whole evolution of tick-borne disease throughout my career. About 30 years ago is when we first started seeing Lyme disease popping up in Wisconsin, and we didn't really have any effective preventative tools at that point. So we saw dogs and people develop Lyme disease at a very high rate. So luckily with the new products that are available for prevention with vaccination, we are seeing much fewer cases of tick disease in Wisconsin. But there are still plenty of dogs out there that are not protected with monthly preventatives and not vaccinated, but that's something that we can improve on. Thanks. We'll see you next time.